So with regard to breast cancer, a major component that we'll be studying about in this presentation is on obesity. So obesity plays a major role within breast cancer through multiple facets, and there's a growing body of literature among each of these facets that we'll talk about. If you look into this diagram specifically, we'll see that there's 5 that we will point out. One in particular will be the inflammation and like the adipokines and the cytokines playing a role in increasing your possible risk of breast cancer when they're with the presence of obesity. Second of all, an elevated cholesterol level also can play a role through a different mechanism from like an inflammatory process as the prior pillar. And now third, hormonal imbalance can play another role, genetic modifications, and of course hyperinsulinemia. So why is this, how does this work exactly? Well, as we're still figuring out these mechanisms to more detail, one thing that we do know that has been seen in prior literature is that premenopause clinical obesity is correlated with an increase in triple-negative breast cancer. And likewise, clinical obesity among individuals with postmenopause have almost over a 20% risk of developing breast cancer in the literature that we've seen already. Now, talking about the hormones specifically, things such as hormones such as estrogen, they're involved in the stimulation of developing these select cancer types. In menopause, what happens is that the estrogen production from the ovaries, it comes to that halt. And this leads to the reduced estrogen levels in the body, and so excessive adiposity or obesity status, they can influence these levels through other hormones, including insulin, which will spike up the blood sugar as well.
Hello, I'm Eunbee Cho. I'm internal medicine resident at UTRGV NAP Medical Center. I will share in this video some facts that might be helpful to know on alcohol consumption and the increased risk of breast cancer. There has been many studies, although most of them are observational, proving the increased risk of breast cancer in patients consuming alcohol. The picture you see on the left of this slide shows the U.S. standard drinking sizes provided by CDC, Centers for Disease Control and Prevention, and in each drink is 14 grams of pure alcohol. One of the studies showed that if you drink 10 grams of alcohol a day, there is 10% increase in risk of breast cancer. The association is dose-dependent, in other words, linearly correlated, and also it is related to drinking patterns like binge drinking. The association was apparent more in the ER-positive, PR-positive breast cancer, or HER2-amplified breast cancer, compared to ER-negative or PR-negative cancers. Although the overall impact of alcohol consumption on breast cancer risk is modest, the risk can be amplified in patients on postmenopausal hormonal therapies, and interestingly, patients on folic acid supplements had a lower risk compared to those who weren't. Although exact mechanism is unknown, there has been several mechanisms suggested on how alcohol consumption can lead to increased breast cancer risk. First is increased circulating estrogen and androgen level observed in the serum of patients on alcohol. Androgen can be metabolized to estrogen by aromatase in the breast tissue. This can explain the increased number of ER-positive breast cancer in this group. Secondly, metabolites from alcohol, such as acetaldehyde, can cause oxidative stress and can cause damage to the DNA. Lastly, alcohol triggers epithelial to mesenchymal transition in breast cancer cell through EGFR snail signaling, during which epithelial cells lose polarity and tight cell-to-cell adhesion, can gain migratory and invasive properties to become mesenchymal cells. This all can lead to cancer development. Also, in the breast tumor profiles, alcohol intake is observed to play a role in epigenetics by decreased number of methylation, leading to increased gene expression. This can be considered as possible mechanisms that explains the association of alcohol intake and increased breast cancer risk.